Now, doctor, a lot of people say that when they consume a particular vitamin supplement, they are actually feeling a lot energetic. Is it true that they are actually feeling energetic, or is it mind playing tricks?
Who requires this? Who doesn't require this? Perception is what it is. When we feeling energetic, most often, more than 50%, there was a trial with I think 25,000 people. The trial was called Vital trial. So they have seen that really there is no benefit. They say they are energetic, but their performance levels are all same. Only.
You are tuned in to Fever 104 FM. The show is called The Superhero Show. My name is Shine, and every Thursday between 6 to 7 on The Superhero Show on Fever 104 FM, we've got Health Waves courtesy Kauvery Hospital, Marathahalli. Joining me in the studio today from Kauvery Hospital, Marathahalli is Dr. Hemkumar. Sir, thank you so much for taking time out and coming to Fever Studio for the third time now?
Yes, Shine.
Okay, before we go ahead, sir, if you could kindly introduce yourself for our listeners.
So I'm Dr. Hemkumar, general physician or internal medicine specialist. Also, I deal with diabetes too.
So today we will be talking about something that a lot of people are consuming, but not responsible consumption, maybe. We're talking about vitamins, right? Now, people are taking a lot of vitamins nowadays, from D3 to multivitamins. There are Instagram reels about it, that this is very healthy for you. What is your viewpoint about this? Should we be consuming multivitamin tablets without going to the doctors? What do you say about it? Is it very dangerous, not that dangerous?
Overconsumption is a problem in our society now. So we consume carbohydrates more, alcohol consumption is more,
Right.
salt consumption is more, fat consumption is more, news consumption is more. Another danger is the vitamin consumption.
Okay.
So taken in very moderate quantities,
Right.
in appropriate situations, the supplements might be useful. Otherwise, our food substances, what we take, the fruits, vegetables, have sufficient amount of vitamins for our day-to-day use. So anything beyond the required amount is not going to be helpful and sometimes harmful too.
And sometimes even harmful. So, okay, so people say it's just vitamin, right? It can't hurt the body. I'm taking something, if I'm consuming a supplement, it is just good things that I'm giving to my body. So how will somebody know what their body needs? Do we have to go to a doctor for that, or can we just figure it out and just take?
So nothing is without harm if you are taking it too much. Even oxygen and water too, they are harmful. They are very inert substances, they are also harmful. So vitamins also in the same category only. So only very few clinical conditions, say for example pregnancy. So we give folic acid to them. If their hemoglobin is slightly low, we give iron supplements. Though for them it is really not required in normal conditions, because they are pregnant, so we give them. There are some people who have long-term illnesses, neurological illnesses, bedridden. For them we can give vitamins. So otherwise, if we are going to give supplements, we should have specific reason for the supplementation, and we should usually document the deficit and then supplement accordingly.
People who are listening into the show right now might be consuming a lot of multivitamins without actually visiting a doctor or checking if the body actually needs it. Can you just in short tell me what can be the harmful effect of that?
So, for example, there are two types of vitamins. So when we say, so we have fat soluble vitamins, A, D, E, K. 4 vitamins are fat soluble. And other vitamins, which is very famous in other ways, it's B complex plus C. So these vitamins are called water soluble vitamins. To an extent, water soluble vitamins will be excreted in the urine if it is an excess. So relatively less harmful, but still in higher quantities there are some specific vitamins, for example pyridoxine, B6. So it is given to treat neurological conditions. It is used to treat the toxicity of some other medicines. But when taken in too much quantity, even this can be harmful. So we have seen almost 20% of people who are taking vitamin supplements have never found out why they are taking it and what is the required amount and how long they should take. So they are just taken by the influencers words and then they take it. No harm in influencing to do something good, but again, is it appropriate to that person? We should know. So that is the primary issue. Second is there is a vitamin D. So because of less sun exposure, they say that vitamin D has to be taken regularly. Yes,
Right.
to an extent we require vitamin D. Our requirement has gone up in the recent past, but excess vitamin D can cause excess calcium in our body. It can make the bones weak also sometimes.
Oh.
So you can get the high calciums can cause stones in the body. So we are getting almost like once in every month or 2 months we get people with high calcium or any of these problems because of their excess calcium, this vitamin D intake. Vitamin E, K can interfere with the blood clotting. People who are on blood thinners, so they can get interaction with these things. Sometimes they can have blood clots and can cause strokes, heart attacks too. Not very common, but theoretically there is a chance for this to happen. So because the benefit also theoretical, the risk is also theoretical, we should consider them in the equal balance.
Now, doctor, a lot of people say that when they consume a particular vitamin supplement, they are actually feeling a lot energetic. So is it true that they are actually feeling energetic, or is it mind playing tricks?
Perception is what it is. So particularly after the COVID pandemic, this trend has become very high. One of the online platform has sold around 2 lakhs units of prescribed vitamin supplements bottles over a period of 6 months.
Okay.
So it's a huge number, and we have almost 900 plus brands of vitamins, multivitamins available. So who requires this? Who doesn't require this? It's a big question. So previously I've told that folic acid is required in pregnancy.
Right.
Iron is required in pregnancy. So beyond this, if we see, there are people who requires specifically vitamin B12 can be deficient because of the food habits. Nowadays we don't have naturally grown animals giving milk. Cattle, even meat doesn't have B12 in it. So they require vitamin B12 supplementation, but not everybody. Somebody who has low hemoglobin, somebody who has unexplained fatigue. So these people require the vitamin B12 supplementation. Otherwise, no routine supplementation. So when we say that we are feeling energetic after we take the vitamin supplementation, most often, more than 50%, there was a trial with I think 25,000 people. The trial was called Vital trial. So they have seen that really there is no benefit. For example, we have to quantify the benefit. If somebody is running 100 meters and they take multivitamin, they should be able to run the 100 meters as lesser time, or they should be able to run 150 meters or 200 meters
Right.
in the same energy level, same time. So it doesn't happen like that. They say they are energetic, but their performance levels are all same. Only. So it's a perspective. So it is like a positive bias we have. So lots of things like that happen. We like somebody, we like some celebrity. We like even doctors. Doctors are also guilty of prescribing unnecessary multivitamins. We like some influencer, some YouTube personality. And when we do something what they are doing, the way they dress, the way they speak. So the same way when they say that this thing is good, this vitamin is good, this will do good for you, we get something called as a placebo effect.
Right.
So this placebo effect will be playing into their mind. I'm not saying placebo effect is always bad. We do lots of things as doctors to give placebo effect, but it's usually for a short duration of time, maybe few days or a couple of weeks. But this happening for months and years together, spending billions of dollars, a huge industry. So $200 billion industry, it is the multivitamin industries. So, but without any tangible benefits.
Okay. Now, when you spoke about tangible benefits, let's say someone who's consuming multivitamins, how will they know if they need multivitamins or any kind of particular vitamin tablet, and how do they figure it out what their body needs?
So usually as a doctor, as a physician, only 2 vitamins we usually test for whether they are deficient or not. Vitamin B12 and vitamin D. So B12 is for any age group when there is unexplained fatigue, neurological symptoms, or hemoglobin is low. These things could be due to vitamin B12 deficiency. Vitamin D, slightly elderly people, aches and pains, weakness of the bones, calcium levels low. So these people, vitamin D. So these are the two age groups we usually suspect whether they are vitamin deficient and then supplement. This is what I am saying, otherwise normal people. There are disease conditions. For example, kidney disease. So we have to supplement vitamin D for them because kidney is the place where the vitamin D is produced.
Okay.
Or metabolized. So we have to supplement them. Same way, some people who has undergone surgery. So gut surgery, intestinal surgery. So vitamin B absorption will be poor for them.
Okay.
So we supplement for them.
So you're saying that they should probably go for a vitamin test?
Yes, if appropriate, not for everybody again.
Huh.
So if we feel appropriate, so for such conditions, then we can do the vitamin testing.
So we want to talk about people who are already on thyroid medicine, BP tablets or diabetes drug, and they're also taking vitamin tablets. Can these vitamin mess with these medication?
Yes, some of the medications can have interactions. So for example, iron supplements can have interaction with thyroid medication.
Okay.
The absorption may go down. And the calcium supplements, drugs containing the medications containing magnesium can interfere with some of the diabetic medication also. That's why usually we prescribe it in a different time period. So these interactions can impact the way we assess the effectiveness of those drug, either a thyroid drug or a diabetic drug. So some of the vitamins, calcium, maybe we have medication, BP medications, which can have interactions with calcium or magnesium containing medications. Usually they are positive interactions, so we don't find anything harm in that, but taken in very higher dosages, so it may be harmful.
Okay. Okay. And there are so many brands, as you mentioned, about 900 odd brands are out there. How will people know what vitamin supplement that they are purchasing online is legit? Is it even safe? How will they know the difference?
So one of the leading e-commerce platform, Amazon, has so many brands in it. Less than 10% have the exact required daily allowance of the vitamins present in it. Most of them have very low dosages of the
Vitamins,
RDS, required daily allowances present in that.
RDL, required
Or
daily allowance.
some of them are higher than what it is really required.
Okay.
So it's very difficult to differentiate. So even we feel it difficult to find out if when we are prescribing also. So we try to keep ourselves safe by keeping very few brands, very old brands, and for a short duration. Nothing is safe to be taken indefinitely without any scientific basis.
Doctor, have you actually treated somebody who was taking a lot of health supplements thinking they were being health conscious?
Yes. So vitamin D is one I have told monthly once or twice we see. So vitamin D is
An
consumed,
overconsumption of that.
overconsumption. So they develop kidney stones, and a couple of times we have seen with a very high calcium levels. So very high calcium levels can even lead to cardiac arrest.
Oh.
So people have come with very high calcium levels, need to be admitted, monitored very closely till we bring them down to normal levels. Even after they stop, so vitamin D, that's what. So it's a fat soluble vitamin. So as we take for some time, it may not be easily visible in the blood how much it is more or how much it is less, because whatever we give goes to the fat, it gets stored in the fat. So only when the consumption goes beyond a threshold, then it starts showing that effect. And the effect will be long lasting because we have the stores which are going to keep releasing this vitamin D even after we stop taking that. So like that, vitamin K, vitamin E and vitamin A also get stored in the fat deposits in our body, and they can keep harming. We see some liver damages also. Excess vitamin consumption, all these fat soluble vitamins, people end up with liver issues also. Almost like 16% of the chronic liver diseases are connected to some or the other supplement consumption. Not necessarily vitamin. All the vitamin supplements have micro minerals also. They have other components also, say selenium, zinc, magnesium. So many other things are added to that. So that way they can harm even the liver.
Okay, so doctor, a lot of people say that, when you started the conversation, you said that our food has enough of vitamins and what we need. But a lot of people say the food is not that healthy nowadays. So what would you have to say to that?
So the nowadays perspective, it's too much. So if I remember in my childhood, we hardly used to get seasonal fruits. No apple all through the year. No citrus fruits all through the year. So nowadays we get all the fruits, all the vegetables available throughout the year. One, due to the improved production, transportation, so aggregation, so lots of technological and social changes which has brought these food items. So in my childhood, for means everybody's childhood, I say my family is a rice eater. So we used to eat only rice as a grain for even months together. So nowadays we don't do that. So we have lots of other grains available. So we have become cosmopolitan. So I would say the food has become
Better.
slightly better. The at least the nutritional, the variety of nutrition available in our food has become much better. So leave aside the pesticide, the preservatives. That argument is different. So if we leave aside those arguments, the available variety of food is much more. So all we need to do is we need to take at least 2 servings of fruit per day, different fruits, seasonal fruit and perennial fruits. Take different grains, each meal, reduce the grain consumption, cereal consumption, but take a different grain. Sometime wheat, sometime rice, sometime the jowar, ragi, bajra, millets. So many millets are available. So keep changing that, and take them in a somewhat cruder form, unpolished, unpreserved type of form. Same type vegetables also. So whatever vegetables available in our vicinity, in our nearby vegetable shop, I think we should keep mix matching all the vegetables. Add some vegetable to each meal, a little vegetable or a greens. We can keep adding. So I think this is sufficient. It's a joke I say. So somebody who doesn't have a teeth should actually take the vitamin supplement. Somebody who has a teeth
Doesn't need.
should chew the vegetables and fruits, which will give sufficient vitamins.
Okay, so one last question before we let you go. People who want to improve their health, listening in, right? As they say on social media, people who want to be superhumans, really fit, where should they start?
So certainly I can't answer for the superhumans. We have to ask the Marvel studios
Marvel
regarding
universe,
that. So, but to be a better human and be a reasonably healthy human being who can do normal day-to-day activities without fatigue, all we have to do is chew our food, eat varieties, do exercise. So most often they come with a fatigue patient. The very common symptoms, fatigue is the common symptoms we get it. So that is not due to deficiencies. The only deficiency for them is the deficiency of physical activity. So we are not unlocking the energy. So it's like you have a tank full of petrol and you forgot your ignition and you forgot your battery. So it's like that. So we have to start moving. So we see marathon runners,
Right.
we see regular runners, sports personalities. They don't eat huge meals or huge this thing. They eat in small quantities only. So eat a healthy meal, do regular physical activities, get out from your chair, get out from your home, walk around. So that will unlock the potential to become a superhuman.
All right, Dr. Hemkumar, thank you so much for coming to Fever FM. This was a very fascinating chat that we have had. And yeah, that is something that a lot of people, I would say, I would accept this. I don't want to on air, but even I have bought a few vitamin supplements intermittently, not too much of consumption here and there. So yeah, it's a word of caution for me and a word of caution for a lot of people who are going to gyms, and I know a lot of gym people take all of these supplements and more. Dr. M. Kumar, thank you so much for coming to the studio. I hope you have a good day ahead of you, sir.
Thank you, Shayan, and have a nice day. And thanks for bringing out this very important topic to your audience.
Thank you, sir. Our pleasure.
Yeah.